This is a 67-year-old woman who had a history of an RD repair in this eye before, as well as had a full thickness macular hole in the right eye. She's had surgery before in this eye at an outside hospital, but now she's coming in with a gray spot in her vision for the past couple months. Of note, she has glaucoma. She's on COSAPT, and prior to having LASIK, she was a high myope. So this is what she looked like on the OCT. She's 20/80. You can see that there's a full thickness macular hole that's there. There's some intraretinal fluid at the edges of the macular hole, but it's certainly full thickness and through the fovea. This is a little interesting case. I think, we might normally think about somebody like this who hadn't had surgery before, having a good chance of getting the hole to close on the first go round. But in someone who has had sort of prior surgery, including the RD repair and a peel before, I'm always thinking about if there's anything else that I can do to sort of increase this patient's chances of getting the hole to close on sort of the first go round. So because it was actually kind of small, I thought first, is there things that I can do besides just jumping to the OR to be able to get it to close? Since it wasn't that large and this patient presumably already had their hyaloid removed, so it doesn't have that sort of vitreous pulling on the retina. So I tried starting drops in this patient. So this is, I started Pred Forte and Ketorolac on this patient and gave them 6 weeks. Unfortunately, the vision actually went down, and you can see that the hole has indeed not closed. In fact, there looks to be a little bit more fluid that's present. So I tried really in this case to sort of manage medically first, and that was not possible. So unfortunately, I took them to the OR. You can see here I'm staining with ICG again, and I'm kind of anticipating that there's going to be a pretty wide peel. You can see that because of the patient's sort of blonde fundus, it's hard to get sort of a really clear sort of staining present, but I think they've had a good peel before. There's a little bit of patchy stuff that's staining green. So I peel a little bit, and then there's a little bit of island that's still remaining right near sort of near the arcade. So I tried to see if I could get an edge, but really I'm not seeing anything. So the technique that I employed in this person is using subretinal blebs. So using a 41 gauge cannula to be able to create subretinal blebs surrounding the macular hole in order to really sort of encourage that like mobilization of the macular tissue to be able to get that together. So this is a technique that I find helpful in cases where there's not a lot of ILM left, and it might be hard to do something like a hinge flap. So you can see I did the bleb, and then I sort of let it be. And this patient had an excellent result. This is post at month 1, and you can see that the hole has closed here.